with board-certified gynecologist Dr. Sherry Thomas here. And Stacey, you had a great question before we went. What was that?
Yeah, Dr. Thomas, I wanted to know as a parent, how do I have that initial conversation with my teen about her menstrual cycle and her gynecology needs?
That's a great question. Well, your daughter's probably been seeing a pediatrician up until she becomes sort of teenager, and then you think she's talking to her friends. Maybe there's a young man hanging around.
Oh, no, there's not. Oh, no, there's not.
And the question is, you know, when she gets to that point, you say, you know, darling, do you want to see your pediatrician, or would you like to go see a gynecologist? And they will let you know. And then a lot of times,
what if they choose wrong? What if they go pediatrician the whole time?
You know, some of the pediatricians are very familiar when the patients become more adolescent, and there's actually a division of pediatric adolescents where the doctors are very familiar with adolescent young ladies, and you can find a particular specialist with that. But a lot of young women will say, you know, Mom, I'd like to see a gynecologist. And then you can say, oh, I've been seeing Dr. So-and-so, and they've usually met your gynecologist. And you say, would you like to see my gynecologist, or would you like to pick one of your own?
Should I go in the room with her?
Ask her.
Okay.
And then if she's under 18 years old, you'll have to have that conversation with the gynecologist whether the information is hers alone or not, and that's a special consent.
That's very interesting.
Well, you know, I wonder about that, about the not going in, because you know, I remember my mom used to come in and just, you know, sat herself there, and it was very uncomfortable. But honestly, like, I didn't know like the questions to ask of my doctor. I mean, and it kind of helped for her to be there. I just didn't like it.
Right. So just ask her, what does she want, and then.
But I mean, should we initially maybe force ourselves there, and then maybe, you know, if there's a situation that we need to duck out, or?
You know, as a gynecologist, I'm very encouraging to have them bring their mother in, and a lot of times the very helpful mothers are great in the room, and sometimes I've had daughters that are more informed about sexually transmitted disease than mothers when they become sexually active. So it's, you know, it's twofold. So I just leave it up to the interaction as I see it and what the mother and the daughter.
Which brings me to a point about the young people, well, the teenagers having sex. And do you think that dialogue takes place in the room, or are they fearful to tell their parent, their mom in the room in front of their gynecologist, yeah, by the way, Mom, I'm having sex? As a doctor, how do you handle that?
So I ask them point blank, I need to know, are you sexually active? Because I need to help you with contraception, I need to help you with birth control, I need to help you understand sexually transmitted diseases. And that's something you might start feeling comfortable talking to your mother with. A lot of them say, I've already talked to my mother about it, and she knows, and that's why we're here, and we have the conversation together. Some of them say, no, I'm pretty uncomfortable about it. And I say, you know, well, let's see about getting to a point where you can talk to your mother about it, because most women that are bringing their daughter to me as a gynecologist want to start having that conversation, and the daughters, I think, and the mothers do too.
But do you ever, I actually had a doctor, and I appreciated it. You know, my mom came in at the beginning, but then they would be like, okay, Mom, it's now time to step out. We're going to have a little bit of conversation. Do most doctors do that? Because I think that probably is a really good thing to do.
That's all up to the patient and the mother.
Okay. Is that something you do, or?
Oh, I recommend that they do what they feel comfortable with. Some daughters want the exam without their mother, and the time they're going to have the exam, we can have that extra conversation, and then I can talk to them about, you know, your mom seems really concerned. Would you like to now bring her in after the exam so we can talk about everything? And that's where we bring it up again. So it's kind of a three-part process.
You really like including the mother in the conversation, because it seems to me that it would be good to say to the patient, to the daughter, now, you know, the mother, why don't you go outside for a little bit, and then have the conversation with the daughter and say, this is a confidential conversation. That way you're going to get the truth. You might not get the truth.
That's easier said than done as a mother. That's easier said than done.
But I think, you know, leaving it up to the doctor is probably the best. But thank you so much for all of this information. I think it's really, you know, helped us steer how we're going to navigate with our daughters. So thank you so much for being here, Dr. Thomas.
Great.
All right, and we'll be back with more Every Way Woman.